The purpose of this test is to test the stability of the knee. The patient will be laying supine and the practitioner should be at the bottom of the treatment table. With one hand, grasp the calcaneus and place the other on the kneecap. Rotate the tibia while placing leg into flexion and putting pressure on the outer side of the patella. This test is the same concept as the pivot shift. The only difference is when placing the knee into flexion, you also want to place the hip into flexion. This tests the PCL. McMurray's tests for a meniscus tear. The patient should be laying supine with the practitioner to the side. Grasp the calcaneus with one hand and the patella with the other. Rotate the foot outward and put knee into flexion and repeat with the foot rotated inward. Posterior sag test for a PCL tear. The patient should be supine with their knees and hips flexed to 90 degrees. Practitioner should be to the side. Hold their legs in the air and then have them keep them in place when you let go. Bounce home test for possible municipal lesions at the knee. The patient will be supine and the practitioner will stand to the side. Place knee slightly into flexion and let go. Clark's sign assesses for cartilage degeneration. The patient should be laying supine and the practitioner should have the web of their hand above the patella. Place the patient's knee into 20 degrees of flexion and ask them to flex their quad. Lockman's identifies an ACL tear. The patient should be laying supine with the knee flexed at 20 degrees and the practitioner should be sitting on the table. Left hand on the femur to stabilize while the right hand pulls the tibia towards you. Posterior drawer test determines if there's an ACL tear. The patient should be laying supine with their knee flexed from 80 to 90 degrees, and the practitioner should sit on the patient's foot. Place your thumbs at the bottom of the knee and the hands on your gastrocnemius. Pull towards you in quick jolts. Posterior drawer test determines a PCL tear. The patient should be laying supine with the knee flexed 80 to 90 degrees, and the practitioner should sit on the patient's foot. Place your thumbs on the bottom of the knee and your hands on the gastrocnemius and push in quick jolts. Patellar glide tests for patellar dislocation. The patient should be laying supine with knee fully extended and the practitioner should be to the side. Glide the patella to both sides and up and down. Patellar grind assesses for patellofemoral syndrome. The patient should be laying supine with knee fully extended and the practitioner should be standing to the side. Place thumbs on the patella and push up and down and side to side while applying pressure. Apley's compression evaluates problems of the meniscus. The patient should be laying prone with the knee flexed at 90 degrees while the practitioner is to the side of the treatment table. Place one hand on the heel and the other on the arch. Medially and laterally rotate the tibia while applying pressure. Apley's distraction identifies ligamentous injuries. Patient should be laying prone, knee flexed 90 degrees and practitioner to the side. Grasp ankle with one hand while stabilizing femur with the other and rotate the leg. Vera stress test shows a lateral joint gap. The patient should be laying supine with the practitioner to the side of the treatment table. With knee fully extended, push the knee towards the patient's body and pull their ankle towards you. Repeat in flexion. Valgus stress test tests for damage to the MCL. The patient should be laying supine with the practitioner next to the table. Pull the patient's knee towards you and push their ankle towards the patient's body.